I think what really drew me to healthcare was the way that people care and have a passion for what they're doing.
It's just important to me to make a difference to the people around me, and I think that is my favorite part and the most important part of leadership for me.
Decisions are being made in Hillsdale for the patients in Hillsdale. They're not being made in Detroit or Grand Rapids or Fort Wayne.
I tell all the new orientees every month at orientation, like, you are critical to our patients' care, so you are critical to us.
I really love the family feel of Hillsdale Hospital. I loved knowing my patients because, we see a lot of the same people over and over, and you grow to care about them, and you want to do well by them. You see them out in the community.
Empathy for your employees, because that's needed, for your community, for your patients, for your vendors. Like, there's so many different aspects.
What it has done for me as a leader of knowing the journey that my family has been through is to truly be compassionate.
You can't make the difference or have the impact that you want to have being locked in your office all day. And it's really important in rural health to know what's going on around you, to have a pulse on what the community needs, to know what the employees need, to know what our patients need.
I think it's important in leadership to have a strong desire. And sometimes that desire should be to put yourself in circumstances that you might not always be ready for. You have to be ready to take on a challenge and show up when others may not be ready to show up.
And so I think as a leadership team, we've got to be able to not just adapt ourselves, but lead our employees to adapt.
Taught me as a leader to obviously understand to be business-minded and focused, but also to be more caring, to be more considerate, to be more understanding of our surroundings.
I think being a leader in healthcare, it's really important that the size of your heart is greater than the size of your ego.
And I think we've always been focused on what's the right thing to do, because I don't think everybody is focused on that. Speaking from a finance, you would think I would say the bottom line. Well, it's not just the bottom line. It's everything. It's making sure that you're taking care of your employees and your patients, and the bottom line.
That is important to know our business and to understand it, very intimately, and to know how to have a margin to be able to invest. But at the end of the day, we have to put that aside and realize that there is another component of this, which is human component, and it's the human touch.
It doesn't matter how important the thing you're working on right now is. If there's a patient-related issue, something that is impeding patient care, you drop what you're doing and you go fix it.
I never feel concerned about speaking to HR, whereas in the bigger system, you have to go down a certain path to speak with HR. I can walk into Stacy's office, and we can have a conversation. I don't have to schedule an appointment a week from now.
So we don't have to go through 900 committees, or if there's something that we identify as detrimental to our patients or our employees, like this is going to cause a poor outcome, we can implement it.
And the leaders of other organizations may not have that same perspective of taking care of a rural community as it is to taking care of a bigger health system in Grand Rapids or Detroit or Fort Wayne.
And then once you get a healthcare administrator or leader passionate, it's hard stopping them, especially if they see what the outcome can be.
I think the most important thing is you need to know sometimes you need to lead, sometimes you need to follow, and sometimes you just got to get out of the way. It's not all black and white. If you want your people to grow, you need to let them lead too.